Hi, I'm Nathaniel, and I chose to talk about substance abuse and how we can combat this addiction problem in America for my persuasive speech. To start off, America's drug problem affects people of all backgrounds and nationality, financial background. Um, it's very easy to get addicted, and for that reason, I feel like there should be a larger effort made by the government to help our addicts, just because of how easy it is to get addicted. Today, as this issue exists, we have this problem between recovery and relapse that is commonplace for many addicts. And some of the ways we can combat this is through like policy amendments and advocacy to aid addicts to get help. And of course, there are going to be some barriers preventing our efforts, be them societal, political, or economic. So, to start off, we can talk about the chemical nature of hard substances. There's both psychological and physical dependencies that each drug creates within its user. Among these, opioids are responsible for the largest proportion of drug related deaths per year, and they usually implicate neural dysfunction and other severe health issues. Following that is stimulants such as cocaine. They are most popular in young adults by almost 13%. And these usually involve cerebrovascular complications, including heart attacks and strokes. The use of multiple drugs increases the risk of death exponentially compared to just one. And it also makes it more difficult when studying the cause of death, as well as just drug effects in general. It's relevant to know about these and be conscious about different drugs and what they do so we can better understand how to mediate their use and abuse. Today, current methods used are counseling, abstinence, and drug replacement, but relapse is common as we still have not discovered the true key to eliminating this very physical and psychological need to do drugs. And recently, there has been a meth epidemic affecting African American and American Indian demographics, and it kind of demonstrates that we have this problem of low education and low income in these spaces, which puts residents at a higher risk for addiction. And they did some studies on this as well. Understanding the roots of the addiction issue will help us to combat and help our smaller communities as well as addicts in general. So some of these ways that we can start to solution is donating to political action committees, especially those advocating for addicts, as well as companies who have pledged programs or charities to help this cause. One of these is the SAMHSA, which has a 24/7 hotline to help rehabilitate addicts. And one of the specific ways that we can see this being effective is in the Helping Others Live Sober program at the Case Western University School of Medicine, and they have a unique social motivation technique that has increased individual morale by over 30% in terms of retention of soberness. So this could be a potential application of something in like the hierarchy of needs, psychologically, socially, to give individuals a bigger sense of purpose in themselves and to help. Because at times it can be hard, and it seems like no matter what we do, there will simply be like more to challenge us endlessly. But we do need the proper resources in place in order to rehabilitate people who are struggling with abuse. Another one of these programs that has been implemented in the past that has seen efficacy for helping addicts is a 12-step system, which was popular in the southeastern states, and incorporates religion into the treatment program. But of course, over the years, the hold of religion on people has lessened a bit. So this program has largely seen more relapse. And finally, there are some barriers, be it corporate interference or societal pressure, that bars our collective effort to help these addicts. But overall, one of the most challenging obstacles is overcoming the afflicted's resistance to treatment, and this is the result of both physical and psychological dependence and a larger sense of shame that can be instilled by society decades worth of like government issued public notices and companies advertisements, as well as this overall connotation we have around addiction being unclean and gross. Something we can do to help overcome this intrinsic resistance to treatment is the social motivation theory, as we talked about with the Case Western, and uplifting therapy, which also helped to improve patient morale by over 40%. So yeah, in conclusion, we talked about the issue as it exists today and the cycle between recovery and relapse, and how we can help with policy and advocacy, as well as the ease of and the dependence that drugs can instill in their users. But yeah, thank you for listening.